Your heart just did something strange. It felt like it stopped for a split second, then slammed once hard against your ribs. Here's the unsettling part. Your heart never actually skipped anything. What you felt was your own electrical system correcting a mistake in real time, and the thump you noticed was actually the fix, not the problem. To understand the flutter, you need to know how a normal heartbeat is built. Every beat starts in a tiny patch of tissue in the right atrium called the sinoatrial node. Your heart's built in pacemaker. It fires an electrical pulse roughly 60 to 100 times a minute, and that pulse spreads down through the atria, pauses briefly at a checkpoint called the AV node, then races down specialized fibers into both ventricles. That traveling pulse is what makes the heart muscle contract in a precise wave, atria first, then ventricles, squeezing blood out in perfect sequence. It takes less than a second from spark to squeeze, and your body repeats this roughly 100,000 times a day without you ever noticing, until occasionally one beat fires from the wrong place. That wrong place beat is called a premature ventricular contraction, or PVC. Instead of waiting for the signal from the sinoatrial node, a cluster of cells inside the ventricle itself fires early, sneaking in an extra contraction before its turn. Doctors describe it simply as when the electrical signal to start your next heartbeat comes from a lower chamber of your heart, called a ventricle, instead of from the usual upper chamber. Here's the part almost nobody expects. That premature beat usually isn't even the sensation you feel. The sinoatrial node has no idea the ventricle jumped the gun, so it keeps firing exactly on its original schedule. But the ventricle is now busy resetting from its early contraction, so when the SA node's next signal arrives on time, the ventricle can't respond yet, and that beat effectively gets skipped. This gap is called a compensatory pause, and it is your heart's way of realigning itself. During that pause, the ventricles keep filling with blood, more than usual, because no contraction is emptying them out. So when the next real signal finally lands, the heart squeezes a noticeably larger volume in one go. That is your flutter. Cardiologists note that with a PVC, your heartbeat pattern goes normal heartbeat, extra beat, slight pause, and then a stronger than normal beat, and that stronger beat has an extra kick because your heart fills with more blood during the pause. Your chest wall and your nerves pick up that one oversized contraction, and your brain interprets it as a thump or a flip, even though every part of the sequence was your heart correctly compensating, not failing. And this happens to almost everyone. Research shows premature ventricular contractions are common among both healthy individuals, with no effect on long-term cardiovascular prognosis, and Holter monitor studies suggest up to 75% of people experience them, most without ever noticing. Under a stress test, closer to 30% of healthy people will show one on the machine in real time. Common triggers make the ventricle a little trigger happy. Stress, poor sleep, caffeine, alcohol, dehydration, low potassium or magnesium, even a minor infection can push those cells to fire early. None of that means your heart is failing. It just means an electrically irritable moment happened once. So when does a flutter actually matter? Doctors get concerned in 3 situations. First, frequency. If PVCs make up more than about 10 to 15% of your total heartbeats in a day, that sustained irregular pattern can gradually weaken the heart muscle into a condition called cardiomyopathy. Second, if beats come in 3s or more back-to-back, that is no longer a PVC, it is ventricular tachycardia, a genuinely dangerous rhythm. And third, if the flutter comes with chest pain, fainting, or severe shortness of breath, or you already have existing heart disease, that combination is a reason to get an ECG, not to shrug it off. For the vast majority of people, an occasional skipped beat is nothing more than your heart's own quality control system doing exactly what it's supposed to do, correcting a stray signal and moving on. But hearts are electrical machines running trillions of perfectly timed pulses over a lifetime, and every so often that system can misfire in far stranger ways than a single flutter. If you want to see what happens when the whole rhythm actually breaks down, subscribe because that story is coming next.